Hi, my name's Keith Chang. I'm a child psychiatrist at Oregon Health and Science University, and I have the pleasure of being the medical director for the Oregon Psychiatric Access Line About Kids, Opal K. The main goal for the Opal programs project was to develop a phone consultation line for primary care providers, particularly pediatricians, to call in and talk to a child psychiatrist about their questions about their patients who have mental health problems.
The Oregon Psychiatric Access Line About Adults, or Opal A as we like to call it, is a hotline that anyone with the legal ability to prescribe medications in the state of Oregon can call and discuss a case with a psychiatrist in real time. And we're there to be on the line as long or as little as somebody needs us to be able to understand how to move forward in a case.
It's pretty easy. I usually just give them my name, they look up my information, verify it, and then they connect me with the psychiatrist who's available. And it's always been friendly, it's not intimidating. They're super nice. We have a nice conversation back and forth. I always learn a lot. I'm able to discuss, this is my plan or my thinking, get other resources, sometimes just discuss a really complex child in real time.
And the other part that I really thoroughly think that's valuable too is that they give you a detailed report when you're done with the conversation, like within less than 30 minutes. So that way you're able to, recap and remember what went on with the conversation. And the other part that I think is valuable is if you're having a problem with the child and you're in that visit, you can step out and say, let me get a consultation. And you can get connected with someone immediately. And what's nice about this is that you can come up with a plan, and while the patient's still there.
What's nice is the continuity, that there's usually the same child psychiatrist on week to week. So if I know I've asked them about one child, I'm particularly working with one of them right now for a child who's really struggling with anxiety, and being able to do the follow-up that we have done this intervention, if it's not successful enough, then moving to what we could do as another option. And I also use Opal Adult because as a pediatrician, I see plenty of young adults who are also struggling. And so Opal K and Opal Adult are both wonderful resources. And I'm in a group practice of 9 providers, and we all utilize the service. It's tremendously helpful.
It's really helpful because I'm super busy. I'm seeing patients nonstop. And so if I'm able to call though in that moment and get a call back, I know I can have an answer for my patient. And because it's in real time, I can go over exactly what I'm seeing with the patient in front of me sometimes, or right after I've completed that visit when the information is fresh.
I just have tremendous gratitude for Opal K. It would be really hard to manage the incoming tide of really distressed both young children and adolescents as well as young adults without the support of Opal K. It's made a tremendous difference in my practice, the families I take care of, and for my entire office practice and the families we care for.
One of the things that we love about Opal is that we are a one-number service. So it doesn't matter whether you're calling about a child or an adult or an older adult, call Opal. We will make sure the call gets to a psychiatrist right now who has the ability to be able to help you with that.